So in this video, I'm going to talk about all of the reasons why absolutely everybody should get the cholesterol balance test from Boston Heart Diagnostics. Stay tuned. Alright, so I'm going to put on the screen the very first time that I took the cholesterol balance test from Boston Heart Diagnostics. This was before I was taking any cholesterol lowering medication. I wanted a baseline to find out what is going on in my body. As you can see, there's four markers, these sterol markers. There's desmosterol, lathosterol, beta-cytosterol, and campesterol. Two of them are reflections of markers that deal with cholesterol production. They're proxies for cholesterol production, the top two, right? So if those numbers are on the right-hand side elevated, that means that your body overproduces, oversynthesizes cholesterol. And on the bottom two markers, beta-cytosterol and campesterol, if they're on the right-hand side elevated, that means that your body overabsorbs cholesterol. This is very, very important to know for a number of reasons. In my earlier video, which I encourage you to go back and watch, I suggested that everybody should find out on the production side whether or not your absolute desmosterol level is below 0.8, because that has been associated scientifically with an increased risk of Alzheimer's. Not a good thing. So when you're looking at the cholesterol balance test results, check absolute desmosterol. You always want it above 0.8, and if you've got an ApoE4 allele, an ApoE4 gene like I do, arguably you want it above 1.0, just to mitigate against that potential risk of Alzheimer's by having absolute desmosterol too low. So that's the first reason to get this test, okay? The second reason is this. If you know, like I know from the first time I did this test, that I'm an overabsorber of cholesterol, what that means is you can use that information to make an informed dietary decision. Now, I'm a huge believer in the lower you can get LDL and ApoB over the course of your life, the longer you're going to live, okay? Anyone that wants to argue against that, honestly, is just ridiculous at this point. The science and the data is so clear. It's just like being anti-establishment for the sake of it. And so you get all these videos online, people saying things like, you can eat as many eggs as you want, they won't raise cholesterol, and other videos saying, yes, they will. And it's all a load of nonsense. What you need to know is whether or not you personally overabsorb cholesterol from the foods that you eat. I know that I do because I've taken the Boston Heart Diagnostics cholesterol balance test. And just purely anecdotally, once I ran an experiment on myself. I didn't eat any eggs a day, then ate 2 eggs a day, and 2 eggs a day blew my total cholesterol like 60 points higher. So for me personally, I think eggs are delicious, incredibly nutritious. They're not in my diet, because I don't want to be blowing my LDL and my ApoB higher because I know I'm an overabsorber. So that's the first thing you can do, is make a dietary decision around reducing cholesterol-rich foods if you know you're an overabsorber. Now, if I wasn't an overabsorber and my markers were on the left-hand side, bring on the eggs. That's how I look at it, right? This is about N of 1, knowing yourself. So those are the first two factors. One, make sure your absolute desmosterol never goes below 0.8 or arguably 1.0, so you never get into that dementia-risk territory. Number two, you can make an informed dietary decision if you know you're an overabsorber, so you never have to watch any of those stupid videos of arguing about whether cholesterol in your diet raises cholesterol in your blood, right? You'll just know. Then when it comes to cholesterol lowering medication, this is the third reason now. There's 2 types of drugs, roughly. I'm going to leave the PCSK9 inhibitors out of it for now. Drugs that reduce cholesterol production, cholesterol synthesis, and drugs that reduce cholesterol absorption. The most famous drug that reduces cholesterol production, cholesterol synthesis, is of course statins. The way that the online folks talk about this, you would think they were the only cholesterol lowering meds that ever were invented. It's just ridiculous. So statins reduce cholesterol synthesis, okay? Cholesterol production. So when you take a statin, and let's say you only take a statin, and then you were to run the Boston Heart Diagnostics cholesterol balance test again, you will see those production markers go to the left, because that's what the effect of the statin reduces the production markers. Now, it's very important, I would argue, and most doctors don't tell their patients this, if you were to start statin monotherapy, which I think is a terrible idea, I'll get to that in a minute, you want to make sure you follow up with a cholesterol balance test to make darn sure your absolute desmosterol hasn't gone too low and therefore triggers the potential risk of Alzheimer's needlessly. That's the first thing, is to use these markers to identify what is the type of drug that's going to work best for you. Let's say hypothetically, you are not an overproducer. So your production markers are on the left-hand side, but you're an overabsorber, right? You go to the doctor, they don't run this test, and they put you on a statin. Well, that would be stupid, wouldn't it? Because the production markers are saying you don't overproduce. It would be much better to know in advance that you're an overabsorber so you can make an informed therapeutic decision to go on a medication that focuses on blocking absorption, right? But doctors don't run this test. They should do, but it's like standard of care is ridiculous. They just go, everyone goes on a statin and see what happens kind of an attitude. Getting this test done, even if you have to go outside your doctor to get it, and I'll explain like I did in the other video where you can get it, is going to mean you can walk into that appointment armed with knowledge. What type of medication is going to work best? So we've got, on the production side, we've got first and foremost statins, but there's another drug that's better than statins called bempedoic acid. And I'm going to do videos on this a different time, right? But bempedoic acid will reduce cholesterol production. The beauty of bempedoic acid is that it doesn't cross the blood-brain barrier like statins. And even if it did, it wouldn't be activated there. It's activated locally in the liver. So you never have to worry about that desmosterol issue, that potential link to Alzheimer's, because that's not how bempedoic acid works. It doesn't get into the brain. All statins can cross the blood-brain barrier. That is the issue with the Alzheimer's risk. But bempedoic acid is the second drug. It's an expensive patented drug. That's a whole other topic that reduces production. Over on the absorption side, the number one drug is a drug called ezetimibe, sometimes called Zetia. And that is the general in charge of blocking cholesterol absorption, right? So I take ezetimibe. Actually, I take bempedoic acid as well, because I know I'm an overabsorber. I mean, if you know you're an overabsorber, it's not the most potent drug for lowering cholesterol, LDL, ApoB, ezetimibe. However, if you're an overabsorber, it can be. It can have a disproportionately lowering effect if you're an overabsorber. For me personally, I don't experience any side effects from it. I think it's a phenomenal drug, ezetimibe. There is another medication that hardly anyone ever talks about. I'm going to have to do a video on this, called cholestyramine. Grandpa, as I like to call that medication. I think it was first approved in 1973. No one ever talks about it. It's a bile acid sequestrant that also helps block overabsorption. So this test, like I said, let's just go over it again quickly because I encourage everyone to get it. First and foremost, run the test to know if whether or not your absolute desmosterol is getting into problem territory. 1.0 or lower is a problem. Second, make informed dietary decisions around whether or not you want to eat cholesterol-rich foods. Third, if you are going to be on medication, run the test before you go on medication because it will guide you as to which one works best. So those are the foundational principles for getting the cholesterol balance test done. It's not a standard lab test. Most insurance companies aren't going to pay for it. If you go to your doctor, most of them may never have heard of it. I get it ordered through my chiropractor. Not many people know this, but chiropractors can order blood work. My chiropractor is the kind of guy, when I'm paying for it, he's like, your money, your choice, get whatever you want. So if you want to use my chiropractor, I'll put a link in the description here, the box, on the website, put it in the video. I don't get paid to say this. It's just a local chiropractor in the area that I live. He does telehealth. You want to call him up and say, hey, Simon Campbell's one of your clients, I believe. He talked about the cholesterol balance test. But he'll do a consultation with you and you can get whatever blood test you want ordered through the chiropractor. I find chiropractors much easier to deal with when it comes to blood tests because they don't have that God complex. You know, it's like, oh, well, aren't you? I don't know why you think you want that test. Like Paul, that's what I call my chiropractor. He's like, it's your money, your choice. Thank you very much. Yes, it is. So anyway, if you got any questions, I'm going to follow up with how you can manipulate these numbers because one time I saw my absolute desmosterol level go too low when I did a follow-up test and I did something specific with altering the medications to bring it back to life. So there's some nuance around how you can follow up with these cholesterol balance tests. So if you've got any questions, put them in the comments box. You know, usual thing, like, share, subscribe, and I'll see you next time.